Hello, everyone. I'm excited to cover this chapter, chapter 15 and chapter 16 on psychological disorders and treatments. It's one of the things that I was super excited to learn about when I took Psych 101 back in the day, and unfortunately, they didn't teach it to us at all. So I hope that you will enjoy just a little bit of an overview of some of the different psychological disorders. How do we define psychological disorders? How do we determine if somebody has a psychological disorder? And what's the difference between somebody that is depressed or somebody that has some worries and some anxiety versus somebody that, has a particular psychological disorder? How can we tell the difference and how can we treat some of those psychological disorders? So I hope through this chapter that you'll understand that we're all different, that we all have a different reality. We all see the world differently. And that's because we've grown up with different experiences, different challenges. We're born with certain genes, and we're a complex mix of all of those things. And the more we know about psychology and the more psychologically aware we are of ourselves, the more we realize that the world's not just black and white. There's lots of gray areas. And I hope you'll understand, in this chapter, I hope you're going to gain an understanding that of some of the psychological struggles and disorders that other people may experience, and maybe that you also experience as well. And then also understand some of the causes of the different psychological disorders and the challenges of treating the different psychological disorders. So in this video, we're just going to cover how do we define normal behavior versus abnormal behavior. The book refers to this as atypical behavior or unusual behavior. So we'll talk about that. How do we diagnose different psychological disorders? What's the prevalence of different psychological disorders? And then some historical perspectives on psychological disorders. So abnormal psychology has been a term that's been around for a very long time, and it's actually an academic field of psychology that's devoted just to the study of psychological disorders. And we have a whole class that's called Abnormal Psychology here at GCC. It's Psych 266, and it covers many of the different psychological disorders. There's a couple hundred actually different psychological disorders, so we can't cover all of them, but it covers many of them. So abnormal is a term that's been used for a long time. The book is using that term atypical, which may be a little bit more descriptive of unusual type behaviors. But when we're looking at psychological disorders, abnormal actually is a pretty good fit for that term. But we're going to talk about, how do we define normal and abnormal? And when we're looking at psychological disorders, we're looking at, is the person distressed about their symptoms? Are those symptoms interfering with their ability to function in life? And that's where we draw the line between more abnormal and normal. So defining abnormal versus abnormal or atypical, as the book can say, we know that normal can vary from culture to culture, from situation to situation, from person to person. Some people are normally reserved, some people are normally kind of outgoing and loud, and that's normal. In some cultures, Americans tend to be very expressive of their emotions. We tend to smile big, laugh really loudly. But if you go to an Asian country, they're much more reserved and they might be a little suspicious of you if you act that way and you show all these emotions, because that's not normal in their particular culture. So we have to look at, is it unusual or is it really abnormal when we're looking at psychology? So some things are atypical or uncommon, but they're not necessarily abnormal. So we really look at harmful dysfunction when we're looking at diagnosing psychological disorder. Is it interfering with the person's ability to function in the world? So the APA definition of abnormality that the book talks about comes up with 4 different features of psychological dysfunction. So there's disturbances in thoughts and feelings and behavior. Feelings can also include emotions. And that those disturbances reflect some type of biological dysfunction, psychological dysfunction, or developmental dysfunctions. So hallucinations can indicate biological dysfunction or brain dysfunction. Hallucinations are where people see things that aren't there, they hear things that aren't there, they may hear voices, they may actually feel things that aren't there. You can actually smell things that aren't there as well. And typically hallucinations occur during schizophrenia, but they can also occur with bipolar disorder, with severe depression. And also we see hallucinations in elderly people. Sometimes medication can cause you to have hallucinations as well. Didn't mention that before. Drugs can definitely cause you to hallucinate. And as people get older, people with Parkinson's often have some brain dysfunction that causes them also to hallucinate. So we know that these particular disturbances are caused by some sort of biological or psychological or even developmental dysfunction. The brain isn't fully developed when we're looking at attention deficit disorder. Um, the parts of the brain might not be fully developed yet. And then distress is another feature that we look at. Is the person distressed about their symptoms? Are they unhappy about their symptoms? Now, there are people with really severe symptoms of schizophrenia that aren't distressed. They're not in touch enough with reality to even recognize there's something wrong with them. But the majority of people with psychological disorders are distressed and unhappy about it. And then deviance is kind of a strong word, but I like it because it fits into the 4Ds here. It's really talking about is the behavior, the thoughts or the feelings that the person is having, are they outside the norms of that person's culture? Are they outside the norm? And so those are the 4 things we look at when we start to think about, does this person have a particular disorder, or are they just going through a really difficult time in their life right now? So, and that's one of the challenges that psychologists and counselors face when somebody comes in for help. How do we diagnose somebody with a particular disorder? Do we diagnose somebody with a particular diagnosis or disorder? And often when people come into counseling, we only spend an hour with them. We're not going to have a full picture of who that person is, and we probably will not have the ability to give them a complete diagnosis just after one meeting. It may take months to really come up with an accurate diagnosis for a person. And many times people come in for help, may not even fit the criteria for any diagnosis. We do have codes that we call V codes, and we also have adjustment disorder diagnoses that are just very mild diagnoses. They're not really psychological disorders, just saying the person is having adjustment difficulties and having anxiety and depression or depression because of that. So oftentimes if you went for help for counseling, that would be the kind of diagnoses that you would get. And then if your symptoms continue for longer than 6 months or so and don't seem to be improving, then we might look at whether or not there is a psychological disorder going on. So the DSM-5 is the manual for psychologists and counselors. All mental health professionals use this DSM-5 to diagnose and classify psychological disorders. So the manual has really great definitions of every disorder and the symptoms that of that particular disorder. Also looks at, are there other disorders you should consider if you're thinking this might be the diagnosis. So it has a page that gives you an outline of the possible symptoms of the disorder and then other things that you need to consider. And it really goes into depth, really describing different psychological disorders. It was first developed in 1952 and it's been revised many, many times with international collaboration. So even though it's written by the American Psychiatric Association, many psychologists from around the world have contributed to the DSM-5, and we've eliminated diagnosis and we've created new diagnoses as our knowledge and understanding of psychology is evolving. One of the sad things is homosexuality used to be considered a psychological disorder, and the diagnosis was removed in 1973. But as our understanding of sexuality has evolved, we've recognized that it's definitely not a disorder, that it's a part of the normal spectrum of human sexuality. There is still a gender identity disorder included in the DSM-5. And as we learn more about transgender and understand more about transgender, that diagnosis may change as well. But just because you're transgender does not mean you'd get that diagnosis. Gender identity disorder just means that you feel like you're the wrong gender and you're distressed about it. And there's a whole criteria for that. This is just an example of kind of the outline page of the DSM-5 for one particular diagnosis, antisocial personality disorder. We'll talk about the personality disorders in one of the last videos that I'm going to cover. But antisocial personality disorder is what most of you probably think about as a psychopath or a sociopath. And this lists many of the symptoms that the person needs to present with in order to be diagnosed with this particular disorder. And if you notice on here, you have to have 3 or more of the following symptoms. And there's 7 symptoms. The more symptoms you have, the more severe the disorder is. And then there's also some other criteria that goes on here. But it describes the symptoms. It does not tell us how to treat the symptoms, doesn't make any recommendations for treatment. It just gives us a good description of the diagnosis. There are also codes here that correspond with every disorder in the DSM-5. This is the DSM-5 code. This is actually the ICD-10 code. And the ICD-10 is an international classifications diseases manual, and it does have information about psychological disorders, and there's a big push to try to combine these 2 manuals because this was developed by the World Health Organization and it is used worldwide. The DSM is also used worldwide, but mostly by psychologists and counselors, mental health people. But we want to try to combine the codes so that they all mean the same thing in every country and for billing purposes as well. One of the other problems with diagnoses is that a lot of times people have more than one psychological disorder. Anxiety and depression are a really good example of that. Many people who suffer from anxiety also suffer from depression. And if you've ever been a little bit depressed, you know that you tend to worry more. So the more depressed you are, the more anxiety you have. The more anxiety you have and the more it interferes with your life, the more depressed you can get. So it's really common to have a comorbid disorder or more than one disorder. There's also something called dual diagnosis, which you might have heard that term, that many people that suffer from psychological disorders also abuse different substances, drugs, and alcohol. Sometimes it's in an attempt to self-medicate. So a person with schizophrenia may smoke marijuana, may feel like that eases their symptoms. They may drink alcohol. They may try other drugs. We see a lot of homeless people, and a lot of times the assumption is that they're drug and alcohol addicts, and that's why they're homeless. But oftentimes they're mentally ill, and they're really just trying to cope with their symptoms, and they really need the mental health treatment. So something to think about. So psychological disorders are actually pretty prevalent. 1 in 4 Americans, about 25% of Americans, will suffer from a diagnosable disorder in a given year. This chart here is talking about the prevalence or the diagnosis that are given on a yearly basis. So 50% of the population will actually meet the criteria for a psychological disorder in their lifetime. And the numbers here represent the annual prevalence, so the percent of the population affected by a disorder over a year. The diathesis stress model, if I can actually say it, of psychological disorders is something that the book talks about. And, why is it that some people get a psychological disorder and other people don't? So it says 50% of us will suffer from a psychological disorder in our lifetime. And what about the other 50%? How do they escape that? So the diathesis stress model attempts to try to understand that a little bit, and it really tries to integrate biological, environmental, and social causes of particular disorders. So what they're saying is this diathesis, it's an underlying predisposition or vulnerability to a certain disorder. So you might be born with a predisposition for a disorder. We know many of the psychological disorders have a genetic component, schizophrenia being one of them. So if you have a parent that has schizophrenia, you have a genetic predisposition, a much higher risk of developing schizophrenia than somebody who doesn't have a parent that has schizophrenia. Also, people that have gone through really severe childhood trauma, there is definitely evidence that children who have lost a parent at a young age are much more prone to severe depression later on in life. So, trauma can lead to a vulnerability to a psychological disorder. A genetic predisposition can also lead to the vulnerability. And what the diastasis stress model says that you may inherit this vulnerability or have this particular vulnerability, and then depending on how your life goes, how your environment is, that determines the probability of whether or not you're going to get a psychological disorder. So if you have a vulnerability and you have a less stress and you're able to cope with that stress, you have a lower probability of that psychological disorder. But if you have difficulty coping and you have some pretty extreme stressful circumstances, then you have a much higher probability of having a psychological disorder. So in the next slideshow, I'm going to talk about anxiety disorders, and we will talk about depression, schizophrenia in much more depth. So I hope you'll stay tuned.